Every innovation that Apex brought out is around the value of caring, with the belief that our innovation can help the patient who unfortunately suffer, and for those caregivers who has to take care of others in a very high pressure environments. The innovation that we're going to share with you today, we brought this out in order to provide the gentlest care for those younger patients, for those who need to face hospitalized journey at a very young age, and of course for reducing stress for caregivers who provide care to those vulnerable. This is Jen, the host for today's webinar. And in today's session, our Regional Product Manager, James Liao, will give complete information on the solution of pediatric care we brought out this year. If you have any question during the session, just keep in mind that you are more than welcome to leave your question with us, and we will answer those in our Q&A session at the end. Without further ado, let's welcome James to introduce and present to you our innovation of 2021, ProCare Auto Pediatric.
Hello, everybody. Today we are going to talk about why do pediatric patients need a specific air mattresses for preventing pressure injury compared to adult patients. I think there are some differences in the anatomic locations and tissue perfusions and other factors that might lead to a different risk to the patients. So here today we are focusing on pediatric patients, and we are going to talk about all those risks and how our mattresses can help. And this is today's agenda. We are going to talk about the clinical background first, and then I'm going to introduce you our solution to the problems. And also we have already provided some prototypes and samples to some users here in Taiwan, and also some samples has been evaluated in Europe as well. And I'm going to also show you the pressure mapping performance on the pediatric air mattresses, and then we will end this session with a summary. And now let's start with clinical background. First of all, pressure injuries are not just commonly seen on adult patients, but also a significant concern to pediatric patients as well. That as per the NPIAP guideline, there are also many researchers globally that are mentioned to this specific point that acute ill or immobilized neonate or young patients are at a particularly risk of pressure injury. For instance, patients with cerebral palsy. And we are also seeing from the same guideline saying that the pressure injury incident rate can be up to 27% in pediatric intensive care units, which is a surprisingly high number. And from those pressure injuries to pediatric patients, we also found a few studies saying that most of those pressure injuries, like up to 50%, are related to medical equipment or medical devices such as CPAP mask, tubings, and the other wires or ECG or EEG electrodes. This finding is showcasing that in all intensive care units, whether they are for adults or for pediatric patients, medical device related pressure injuries are a great concern to those patients in the care units. And lastly, there was a finding from 2002 that is the comparison of different interface pressure in pediatric patients among various support surveys that these findings show us that the standard hospital mattress yield high interface pressures. Combine all these factors here, we can say that those acutely ill or immobilized pediatric patients, especially those one in pediatric intensive care units, are at really at a really high risk of pressure injury if those caregivers or those family members are not really paying attention to those equipment around the patient. And one of the most important equipment people are sometimes not paying particular attention to is the mattresses for the pediatric patients. And we can see this table from one article on a BNC Health Service research in 2018, showing that the pediatric patient should be between 1 month to 18 years old. And out of those pediatric patients who are between 4 months to 18 years old would be put in the PICU for several reasons, such as those patients with diseases like respiratory illness or the other like neurological disorders, and such as musculoskeletal disorders and the other chronic diseases. Pressure injuries in pediatric population can be very different from those of adult patients based on their anatomic structure and physiological characteristics. For instance, with a much thinner and functionally immature epidermal layer, which is susceptible to excessive water loss, and pediatric skin is also less protected against prolonged pressure and friction and shear force as well. Therefore, an optimal skin care is very important when taking care of pediatric patients. Since more than half pediatric patients are in risk of medical device-related pressure injuries, there are studies have shown that related softer muscle and fat tissue structure are one of the reasons for them to be less defensive against deformation-related injuries, especially when misplaced between the skin and the mattress. So this device may fail to be noticed by nurses. So as you can see on the right hand side here, when the force is pressed against the skin to a pediatric patient, the deformation, the percentage of deformation is different to those of adult patients. While sacrum and heels are the two most prevalent locations for pressure injuries in adult patients, the occiput, largest bony prominence in the pediatric population, is the most common locations they are susceptible to pressure injuries. And because a young patient has a proportionally larger and heavier head, occiput pressure injuries are frequently seen in younger patients. Besides anatomic structure, one of the reasons is also because children younger than 5 years cannot properly differentiate pressure sensation from other sensory perceptions, such as medical device, because of their development status. There was one research published on a Pediatric Critical Care Medicine journal showing that the clinical research they did to 322 pediatric patients, the pressure injury incident rate was 27%. And out of those 27%, they have found 199 pressure injuries, staging from stage 1 to stage 3. And among those stage 2 to stage 3, there was 19 of them involved with the patient's head, so it's 32%. And the other anatomic location that found pressure injury on patients with stage 3 pressure injuries are occiput, ear, chest, and coccyx. And as you can see on the figure on the left-hand side here, there are also other locations that are at particularly high risk of pressure injuries, elbow, iliacus, ankles, heels, and toes. So these are the anatomic locations that we should pay particularly attention to pediatric patients in terms of pressure area care. And like when taking care of adult patients, risk assessment is a central component of clinical practice and a necessary first step aimed at identifying individuals who are susceptible to pressure injuries when taking care of pediatric patients too. This Brandon Q scale has been widely put into practice in terms of pressure injury risk assessment in pediatric patients. Aside from those 6 subscales in Brandon scale, tissue perfusion and oxygenation in as an intrinsic aspect of tissue tolerance was added to assess the patient's conditions. And factors that affect tissue perfusion and oxygenation would actually lower tissue tolerance to withstand pressure. So this is a particularly important subscale for critically ill patients, as many require vasopressor medicines and fluid resuscitation. And so this subscale is evaluated according to patient's pulse oximetry reading and blood study and capillary refill, or patient's physiologic response to a change in positions. In this page, you can see the table on the left are the risk factors for intensity and duration of pressure. So the assessment is about patient's mobility, activity, and sensory perception. And on the right hand side, the other 4 subscales are all about tolerance of skin and supporting surfaces. So that would be the moisture, the friction and shear, and the nutrition level of the patients. And the latest one is the tissue perfusion and oxygenation that is specially assessed when using Brandon Q scale. And all these scoring description in all the subscales are actually different than those of Brandon scale for adult patients. So the application of this Brandon Q scale to pediatric ICU or the other pediatric care units will be of very high importance. Understanding those risk factors for pressure injury in pediatric patients is essential when selecting adequate support service to those patients. So here there are some key points when it comes to selecting the support service for pediatric populations. One of the white paper from NPIAP conclude that a service needs to be envelope the patient to distribute the pressure provide a low-friction interface to reduce shear, accommodate patients' mobility status, and be appropriate for the developmental age of the patient. And also, providers should take into consideration the frequent movement and growth requirement of pediatric patients. Also, the support service should conform to the misplacement of tubes and lines and decrease pressure injury susceptibility. The Professor Amit Geffen and EPUAP trustee published a research study indicating that ASL mattress can provide a superior protection against increased soft tissue deformations around a misplaced tube comparing to a foam mattress. The envelopment offered by ASL mattress increase contact area and diminish contact pressure between the mattress and the patient's skin and the tube. So as you can see in the figures here, the deformation that occur to the patient's fat and muscle when the patient is in contact with the tube on a ASL mattress is actually less than when it is in contact with the tube on a foam mattress. So therefore, ASL mattress can actually provide a superior protection against the misplaced tubing on the patient's skin. In consideration of those aforementioned risk factors and clinical findings, we have a different design thinking when it comes to providing ASL mattress for pediatric patients. One of the key points is because the proportion of anatomic locations in contact with the ASLs for pediatric patients is significantly different than those of adult patients when lying on an ASL mattress. As you can see from the picture here, the left-hand side is adult patient on a regular replacement ASL mattress, and the one on the right-hand side is a pediatric patient on a pediatric ASL mattress. The spacing between each ASL is narrow, as indicated by the photo. So imagine a pediatric patient lying on an ASL mattress designed for adults. We believe that the intensity and the duration of pressure that was designed for adult patients may not be ideal for the pediatric patients. And also because of the structure of the ASL mattress, in fact, the pressure will be applied to the patient's body in a greater proportion from one single ASL. And also because the regular replacement ASL mattress would usually induce a significant movement of ASLs, and the undulating feeling to the patients will be very significant. That would probably affect the patient's sleep quality. Therefore, usually we can see that there are more ASL on the ASL mattresses for pediatric patients. And now I'm honored to present you our latest solution. The Pocket Auto Pediatric mattress system is a new family member to the Pocket range from Apex Medical. And Pocket Auto Pediatric is a mattress system that is designed to provide a better pressure area care, greater comfort, and improve quality of life for pediatric patients in high to very high risk of pressure injury. this mattress comes with 4 different sizes. In the limbs, we provide two options. There is 140 and 150. And in the width, we have 65 and 70 centimeter as the selection for different medical beds. And this Pocare Auto Pediatric model can be used on pediatric patients weigh between 5 to 95 kilograms. So when we designed this mattress, we did consider the growth rate of a pediatric patient from very young, let's say 4 months old to 18 years old. To help tackle those problems during daily clinical practice, we have designed the Pocare Auto Pediatric with a very low friction and shears on the top cover, and also we have adapt multiple and smaller tiny cells, and to reduce the moisture and heat for the patient on top. We have also designed a micro lower loss function alongside the air cells together with the multi-functional top cover that is with a very high moisture vapor transmission rate. And in consideration of the treatment and also the patient's sleep quality, we have 3 different therapy modes on this model. That would be alternating mode, continuous low pressure mode, and the other innovative alternating low pressure mode, with 4 different cycle time settings from 10 minutes to 25 minutes for caregivers to select from. Also, in terms of emergency in the care environments, the CPR deflection of the mattress will be less than 15 seconds. As I mentioned before, Pocare Auto Pediatric is able to offer the most optimal pressure to most pediatric patients, from 5 kg to 95 kg, by offering excellent pressure relief through its extremely low pressure level within the purpose-built mattress. This will be ideal for especially for those patients who are susceptible to deformation-related injuries in any pediatric care units. So as you can see on the left-hand side, the pressure mapping under a traditional alternating mode is very low, way below 32 millimeter mercury.
And so this is our Pocare Auto Pediatric, our latest innovation that we go to the marketplace this year. And as you can see, we put it on the Pocare Auto mattress system that we designed for adult patient. So the size of this pediatric mattress is comparably smaller. Especially this one is actually just 150 in limbs and 65 in width. And as you can see that both mattresses that we select high quality materials, especially this one, the top cover that is multi-functional, such as 4-way stretch and low friction, that is able to provide a really good environment to a patient's body contour. And also the material is very highly vapor permeable, so that when the patient is on this mattress for hours, there will be no heat and no sweating for the patient lying on the mattress. So as you can see that this is our the pump of our Poké Auto Pediatric that is actually the same design as our Poké Auto that we designed for adult patient. And to install the pump to the bag, you will need to put on the hood to the panel and then connect the power cord and put the power cord through the cable management that we designed on the side of the mattress for a safer environment in the care facilities. While the quick connector is on the other side, that is very easy to install to connect the mattress to the pump, and also at the end of the mattress there is a cap for the quick connector, so that this mattress can be transferred from one room to the other, and the transport time of this mattress that is actually 12 hours. The mattress can support the patient from one room to the other room, as I said, and also if there is any power failure in the facility, you can also support the patient temporarily. So as I mentioned, this mattress system can support patient from 5 kilogram to 95 kilogram through this mattress configuration. As you can see here, there are multiple aircell inside, and the air mattress are really soft and comfortable for the patient, even though you can support the pediatric patient up to 95 kilograms. For the safety of patients in care facility, we have designed a CPR knot on the side of the mattress in case there is any emergency happen to the patient. As the knot been turned to open, the mattress will be deflated in 15 seconds for caregivers to provide CPR procedure to the patient.
And the most important innovation that we have introduced to this Poké Auto Pediatric is the tiny cell technology. As we mentioned before, the gap between each air cell and the spacing between each air cells on the mattress for the pediatric patient should be very narrow, so that the perception the patient is feeling will be less when the mattress is offering traditional alternating mode or the other alternating low pressure mode. So therefore, this tiny cell technology actually empowers caregivers by providing effective pressure relief while supporting patient's body contour in any position to prevent the patient from sinking in between air cells, such as semi-flower position for pediatric patients in risk of respiratory problems, or the patient sometimes needs to be in lateral position because the patient might be experiencing a muscle contracture.
Poké Auto Pediatric is a 7-inch mattress replacement. There are 24 air cells for the 140 centimeter, and we also have the other size. There are 26 pieces of air cell for the mattress. And as you can see here, not only the patient can be supported by the mattress in a very low pressure range, but also the gap between each air cell is very narrow, so that the patients won't be sinking in between any two air cells. And also the width of each tiny cell is only 5.8 centimeter. So as you can see here, compared to the air cell on the adult mattress, the width of the air cell is comparable smaller, right? And so here is our tiny cell with this special design that is actually patent pending. The special design of this 7-inch ASL that is able to support the patient and without any risks to the patient when the patient is in spine position or in lateral position, or even when the patient is about to stand out and exiting from the mattress.
To help achieve a less perceived undulating feeling to the patient, Pocket Auto Pediatric is designed with innovative therapy mode called alternating low pressure that is able to deliver a moderate alternating therapy for patients who cope less well with this undulating feeling, especially when a traditional alternating therapy is offered, or when the patient is on a air mattress designed for adults. This kind of undulating feeling can be very obvious, can be very significant to the patient, especially when they are sleeping. So this function is also able to relieve prolonged pressure of a patient's body as effective as other therapies most can. So this will still be exceptionally beneficial for patients with cerebral palsy or patients with muscle paralysis during their treatment journey. Basically, this alternating low pressure is alternating therapy, but with a higher deflecting pressure in the deflecting cell and lower inflecting pressure in those inflecting air cells. So overall, as you can see from the figure on the left-hand side here, the bottom one, the differences between each air cell is less, so that it will generate a less perceived undulating feeling to the patient. And we also believe that this will help patients' sleep quality. And this is an overview to the pump of Pocket Auto Pediatric, as it is an auto model that is actually constantly calibrating and constantly adjust in accordance with patients' weight and positions. For those patients from 5 kg to maximum 95 kg. As you can see on the pump, that we have the traditional alternating therapy and the alternating low pressure therapy and the continuous low pressure therapy, along with the care mode, the MESFER mode for conducting care procedures when taking care of pediatric patients. And from those three therapy modes, the traditional alternating mode and the alternating low pressure mode are offered together with 4 cycle time options from 10 minutes to 25 minutes. And as you can see in the middle one, this one is the alternating low pressure. As we mentioned, it can offer a less perceived undulating feeling by generating a less significant alternating movement on the ASL mattress. And now let's take a look at the product.
So our Pocket Auto Pediatric is able to offer auto adjustment of pressure to the patient. That means the mattress is able to constantly adjust the pressure to the patient when for the patient in any position, and if there is any significant movement on the mattress, the pressure here will be recalibrated, and once it is done, the light here will be lit on all the time. On the other hand, on this model, we have MESFER, this function for care procedures to the patient. And there are three different therapy mode. One is the traditional alternating therapy, and our innovative alternating low pressure therapy, and the other one is the continuous low pressure therapy. And this alternating low pressure therapy is a little bit different than the traditional one, and that means when the pump is in this mode, the air pressure in the deflecting air cell will be higher, and the air pressure in the inflating cell will be lower. So overall, the movement on the mattress to the patient to feel during the night will be less. And both alternating low pressure and the traditional alternating therapy, these two, the caregiver will be able to select from 4 different cycle time for these two therapy modes. That means if the patient is not feeling feeling adapted to the therapy, or if the skin assessment is allowed, caregiver is able to stay down or stay out for the patient by selecting a different cycle time. And here there are several alarm if there is any abnormality to the mattress. And we also have finally the function called tuning function that is able to fine-tune the pressure in the mattress one level higher or one level lower. And so overall, the mattress is very robust and reliable, that is able to provide the pediatric patient a very good support. And the final point I want to mention here is the pump that is actually very, very quiet. So when the patient is lying on this Procare Auto Pediatric during the night, I think overall it will be very quiet, so the patient won't be disturbed.
Other than those functions and features that we have introduced in the previous slides, we also have heel relief function on this Procare Auto Pediatric model. And we introduced this function to this model due to the low thickness of tissue on the heels for pediatric patients. Could be one of the most common anatomic sign for pressure injuries. Therefore, we are offering this function that is able to offer zero pressure setting by deflecting the air cells at the heel area. The next one would be the micro lower loss that is able to provide a good ventilation inside the mattress, circulating the air in the covers to help reduce the accumulation of heat and moisture. And finally, the effective pressure relief, as we mentioned, are all below 32 millimeter mercury. We will talk about the pressure mapping performance later. However, the key point we want to mention here is the air cell at the head section on this model. They are also alternating to prevent outsupport pressure injuries to those pediatric patients in risk. As we have mentioned several times, the top cover is a multifunctional four-way stretch PU cover that is able to offer a very low friction and shear force, and also is made with high quality material that is able to offer a very high vapor permeability. and yet still it is water resistant, and also is also a flame retardant that has been tested and certified by BS 71, 75, Quick 5, and Quick 7. And of course, because pediatric patients' skin is quite susceptible to chemicals and other excessive water loss, so the biocompatibility of this cover is also very important that we have considered, and we have the cover tested and passed the ISO standards for such features. On the other hand, as we also mentioned, the effective pressure relief also patient's sleep quality. In this Poké Auto Pediatric model, we have select a very high quality, durable TPU air cells that is very highly resistant to hydrolysis reaction. And during our lab test, we have inflate and deflate 105,000 times inflation testing, and all these test results were very good to show us that this is the material that we should select for the Poké Auto Pediatric. And there are 24 air cells in 7 inches for the pediatric mattress in 140 centimeter, and on the other hand, for the 150 centimeter the size, we have 26 pieces of this TPU air cell. And now let's take a look at the feedback from some of the users that we have introduced the Poké Auto Pediatric to. The first patient was a 3 years old male pediatric patient with acute necrotizing encephalopathy, and he is 94 centimeter high and 17 kilograms. He had no experience in lying on a support surface like this one in the past. He felt very comfortable when lying on our Poké Auto Pediatric, and he had a very good sleep quality. His mother found it very easy to reposition him and easy to clean the mattress. She said, we use a mesh firm function for chest physiotherapy. The second patient was a 10 years old female pediatric patient with muscular dystrophy, and she is 130 centimeter high with only 14 kilograms. She used to lie on adult air mattresses and often feel discomfort since the gap between the air cells was too wide, and also the noise level from the pump was too high. And when she tested the Poké Auto Pediatric, she felt very satisfied with the comfort level after lying on the mattress, and that is thanks to the alternating low pressure mode that we can provide from this pump, and so it provides a greater comfort to this patient as well. And she especially mentioned that the noise level of the pump is very low. In fact, the product is only with 20 average decibel noise level from the pump. The third patient was a 40 years old female patient with cerebral palsy. She is 135 centimeter high and with only 32 kilograms. Since she has been living 40 years with this disease. She had some experience lying on a adult air mattress, and she often feel discomfort during the inflation and deflation process, because the air cells would lead to the significant movement would lead to a poor sleeping experience. And so she was especially fond of the alternating low pressure mode after lying on the mattress for a few days, and she believed that is the minor pressure change that can provide the greater comfort to herself, and she also feel like no pain on the skin surface when she was lying on the mattress. And so these are the three cases we took our prototypes of this model to. And when testing the product with these patients, we feel very proud that I think we are doing the right thing. And earlier this year, we also introduced this model to different reference sites. The first one is Dr. Pablo Garcia in the Hospital Clinical University of Valencia in Spain. He is a professor that we currently are working with. Therefore, he recently published his clinical research of Pocket Ultima on EPUAP annual meeting, and we are now going to conduct a new clinical evaluation of Pocket Auto Pediatric with him. The second one is Arcom's Children's Hospice in the UK. This organization is a charity organization with a number of children's hospice in the mainland UK. So we recently donated one Pocket Auto Pediatric to this organization for clinical evaluation and testimonial, which should be published later this year or early next year. And the number 3 is the Odense University Hospital in Denmark. We have actually installed 6 units of this Pocket Auto Pediatric by our partner in Denmark earlier this year. And on the other hand, we also have our partner in Italy introduce this model to the Gasolini Pediatric Institution in the west part of Italy for their clinical evaluation early this year. And now let's take a look at the pressure mapping performance of this model from the lab test we conducted in our office. Here is the summary table. As you can see, the traditional alternating mode and the alternating low pressure mode are all able to offer excellent pressure relief. As you can see, the PRI are all 100% below 32 millimeter mercury, whether the patient is in supine position or in sitting position or in lateral positions. As you can see from this table, also the maximum average pressure from both therapy are all quite way below 32 millimeter mercury in all 3 different positions. Even if the lateral position usually could generate a higher average pressure, as you can see here, this number are 26.6 millimeter mercury when the alternating therapy is offered, and 27.2 millimeter mercury when the alternating low pressure mode is offered. So overall, I think this model is able to provide an excellent therapy mode and the performance. And now the next page, let's take a look at the pressure mapping. First of all, this is the traditional alternating therapy when the patient is in supine position. As you can see from the table here, the maximum average pressure is 18.4 and the minimum is 15.2. And overall, the PI is 100% way below 32 millimeter mercury during the testing time. And the same performance can be observed here when the patient is in sitting position and the pump is offering the alternating mode. The average pressure is also way below not only just 32 millimeter mercury, but below 20 millimeter mercury for 100% of the time of the testing time. And when the patient is in lateral position, it generally would create a higher contact pressure from the patient to the surface. But still, when this pediatric patient is in this position, still the max average pressure and the minimum average pressure are all still below 32 millimeter mercury for 100% of the testing time. As we mentioned before, alternating low pressure theoretically can increase the sleep quality for the patient, but also this mode is still as effective as the traditional therapy mode. So as we can see from the pressure mapping here and the average pressure here, the test result would also very good in terms of pressure area care. The same performance can also be observed when the patient is in sitting position and the pump is offering alternating low pressure mode. And also to the patients in lateral position, the alternating low pressure mode is offering the similar performance as the traditional alternating therapy mode can. So overall, as you can see from the all these pressure mapping, we did the testing in our lab, and these test results show us that the alternating low pressure mode can be as effective as the traditional alternating mode, while it theoretically can increase the patient's sleep quality by its less undulating movement on the air cells of the mattress. And now finally, the summary of today's sessions. The first key point is the pediatric patients are vulnerable to pressure injuries formation due to their differences in the proportion of anatomical locations, tissue property, and physiological characteristics. Therefore, a comprehensive care plan, including a risk assessment, like the Brandon Q scale that we mentioned, also the prevention or treatment strategy, and the selection of adequate support service is extremely important when providing care to pediatric patients. Here I would like to add one point is the medical device related pressure injury should also be one of the key points when taking care of pediatric patients, as there are some studies showcasing that up to 50% of the pressure injury in the pediatric care units were generated by medical device and the medical equipment around the patient. Therefore, in Apex Medical here, we designed this ProCare Auto Pediatric mattresses to provide a better pressure area care and greater comfort, and hopefully to improve the quality of life for those pediatric patients. This is our goal, and I believe together we can introduce this model to those stakeholders, especially those patients in in pain, those patients suffering from their diseases. And I hope that we can have this matrix to help them in the way they should be feel more comfortable and compared to lying on the foam mattress or lying on the adult air mattresses. And therefore, this is the main goal that and the main mission we decided to launch this model into the marketplace. So finally, thank you for listening to today's sessions. I'm very glad that I can introduce all the clinical backgrounds of pediatric patients and our solution to the problems. And if you have any question, please contact us. We have several correspondents in different regions, different countries. Also, we have all of our product information and some related information on our website and social medias. Thank you very much for watching. Bye-bye.
Thank you, James, for such comprehensive insight of the Poké Auto Pediatric.
You're welcome.
And we believe that bringing this solution to the market can be very beneficial, not only for the pediatric patient, but also for those who take care of them as well.
Indeed.
So, okay, so let's welcome, let's have some Q&A.
All right.
Here. Okay, so I can see there are quite a few of questions about this model. Let's go through it.
Okay.
The first one, okay. What's the identical part between Poké Auto and Poké Auto Pediatric?
Okay, so as you can see, from the side of these two matrices, even though the material that we use on both matrices are identical, however, because of the differences on the size, so the part here in the matrix cannot be shared with the one that we create for adult patients. However, the quick connector at the end of the tubing is identical, and most of the electrical component inside the pump are identical as well. So for our distributor and those care facility who use our products, this will be easier for them to manage different spare parts, and also overall the cost for their preparation of spare parts will be lower as well. Thank you.
Okay, and next one. Okay, this one. The height of cell is 7 inch. Is that cell on cell, or you can tell us a bit more about the teeny cell?
Okay, so the height of this pediatric mattress is 7 inch, while our Poké Auto, which is designed for adult patient, is an 8 inch replacement. And for this 7 inch air cell on the Poké Auto Pediatric, in fact, yeah, indeed, it is a cell-on-cell construction. And so you can see that there are two tubes on the side. The bottom one is the one that is constantly static, that you won't be alternating all the time. So it is filled with air all the time. And the upper two chambers here are alternating if the pump is in traditional alternating or the alternating low pressure therapy mode. So also we use this special design that, as I mentioned in the previous session, that is right now is patent pending, and we have this special air cell design that is able to support the pediatric patient while providing the excellent pressure relief to the patient, especially when they are in any kind of different positions, such as in lateral position or in the sitting position as well. like I just mentioned in the end of the next session. So overall, TV cell is and I think it's that is innovation that we create specifically for pediatric patient, and we hope that this can really help for all those nurses and family members as well to take care of their pediatric patient. Yeah.
Okay. So, if there's any question, please feel free to leave in the chat box, and we can answer that right now. Okay, so, and I believe that these are all the questions we have today.
All right.
And if you have any question or inquiry or anything that you want to know about, feel free to contact our representative, and we will happy to hear from you. And also, we'll be very looking forward to hearing from yourself. And that's the end of today's session, and we can see you next time.
Thank you. Bye-bye.